Hi, everyone, and welcome to MGFA's Wellness Series webinar, MG Considerations in Dentistry. My name is Jenna Mvalo, and I'm the Director of Patient Advocacy and Community Engagement at the MGFA, and I'll be moderating today's session. Before we get started, I'd like to go over a few housekeeping items. Participants will remain on mute throughout the presentation. Please submit your questions via the Zoom Q&A icon located at the bottom of the Zoom menu bar, and we'll answer the questions during the Q&A segment. If you want to say hi or submit a comment, you can do that using the comment icon located at the bottom of the Zoom menu bar. Today's session will be recorded and available live. Now I'd like to give special thanks for the support of our Wellness Series sponsors, Alexion, Argenix, UCB, and Momenta, now a part of the Janssen Pharmaceutical Companies of Johnson & Johnson. We've got a great presentation ahead, and now it's my pleasure to introduce today's presenter, Dr. Eugene Casagrande. Dr. Casagrande has practiced cosmetic and restorative dentistry for over 30 years in Los Angeles. He is the past president of the California State Board of Dentistry and the Los Angeles Dental Society, and is a fellow of the American and International Colleges of Dentists. As a director of international and professional relations for Milestone Scientific for over 22 years, he has published multiple articles and has lectured both nationally and internationally at over 120 dental schools in over 55 countries. Dr. Casagrande, welcome, and we'll hand it over to you.
Thank you, Jenna, and thank you very much for inviting me to give a presentation about considerations of myasthenics in dentistry. For those of you listening, I am one of you. I am a dentist and I have myasthenia for about the last 11 years. So I think I know a little bit about the correlation between these two. And I'm going to give you some ideas and some considerations when you go to the dentist. So let me get on here now, and no, that's the wrong one. Let's go here, and we can start. And I'd be happy to take any questions, as Jenna suggested, later on after this brief presentation. So, you know, myasthenia gravis in dentistry is very important. Dentistry is a part of a normal health care program and should not be avoided or feared by myasthenia gravis patients. Good dental health can prevent oral problems, including gingival infections that can be more of an issue with MG patients than with other people. Oral infections and or the stress of anticipating or undergoing dental treatment may precipitate or worsen weakness or myasthenic crisis. Controlled MG patients can tolerate dental treatment with modest accommodations, planning, and cooperation by the dentist and the dental hygienist and the dental staff, all working together to take care of you. Uncontrolled myasthenia gravis patients may need to be treated through hospital dentistry or special care programs in larger health care centers. So it depends really about your status and how myasthenia is affecting you as we go through this program. The most important thing, I think, is to educate and inform. Become educated yourself about myasthenia gravis so that you can discuss the disease and your symptoms with the dental team, the dentist, the dental hygienist, the dental assistant, and the receptionist, because you have to assume that they don't really know about myasthenia gravis, okay? So you have to know about it, and you have to be the mentor to them as far as your disease. Since myasthenia gravis is so rare, expect that the dental team might not know that it's an autoimmune, neuromuscular, non-contagious disease that can affect your dental treatment. Inform the dental team about MG, your particular condition, your current treatment, and the medications, your symptoms, and your limitations, if any. This is very important. You have to assume that they don't really know much about the disease, and little do they know about your particular condition on that particular day. So it's very, very important to talk to them. Let them know how you're feeling, whether you're in remission, whether you're not in remission, and having problems. This is very, very important. For more comprehensive information, access, print out, and give to your dental provider MGFA's dental brochure, which is very, very comprehensive. It is very, very important to the whole dental team. And so what I suggest is you print this out. You can find it. It's called Dental Treatment Considerations for the Dental Care Team at the Myasthenia Gravis MGFA website, which is myasthenia.org. You can look for it there. Just noting MG on a medical history form is not enough, because many times the dentist doesn't pay attention or enough attention and might slip right over that. So you have to just inform them, put it on your history form, medical history form, but then go further and explain, doctor, I put down MG. Do you know what it is? Here's the situation. Here's what it is. Here how it's affecting me today, and we'll go on from there. But it's very, very important that you educate and inform the dentist. Dental appointments are very important. Usually morning appointments are desirable, but this really depends on whether you're at your best in the morning. There's some myasthenics that get stronger as the day goes on, and so whatever's best time for you is the time to make the appointment. You remember, you are the important thing in this whole dental procedure. Plan on being rested and unstressed to the extent possible before the appointment to lessen the chance of needing to cancel the appointment. So get some rest the night before, rest, in that morning, whatever. And try and unstress, because dentistry is not that stressful when you really come down to it. And we have ways of alleviating that stress. Take all your regular medications before your appointment. On the day of your appointment, take whatever drugs you normally take that morning. But if taking Methadone, which is prednistigmine, take a pill at least 1 hour before the appointment for optimal oral, facial, and neck strength, and to decrease the risk of myasthenic weakness or crisis during the dental session. So if you normally take Methadone every 3-4 hours and your appointment's in the afternoon, take it about an hour ahead of your appointment. Before stressful, extensive, or complicated procedures like multiple extractions or general anesthesia, discuss with your dentist and physician, neurologist, hopefully, whether there is a need to increase your steroid dosage if you're taking steroids. If you're undergoing plasma exchange or plasmapheresis, and your protocol involves the use of anticoagulants, blood thinners, schedule your dental treatment for a non-exchange day in the treatment sequence. To avoid unnecessary stress, arrive to the office in time to allow a little rest before the appointment. In hot weather, which we have here in Arizona where I live, it will help to arrive and be refreshed in the air-conditioned office before the scheduled appointment. If taking immunosuppressant drugs like Imuran, Cellcept, which many of us take, you may be more susceptible to infection. So ask to be seated to relax in a dental chair as soon as possible to avoid sitting in a crowded room. This is especially important in today's world when we have a virus going crazy, and many people are canceling dental appointments because they don't want to be, around other people. I think that you'll find that most dentists are taking the COVID virus very seriously, and don't schedule appointments where a lot of people are in the waiting room, or at least have ways of seeing the patients in a way that will be okay for you. To take comfort in knowing that the dental team uses what we call universal precautions: gloves, masks, and enhanced infection control measures. So in this day of COVID, you'll find that they're doing even extra things like plexiglass and putting in air purifiers that change the air in the operatory every couple, 3-4 minutes. Things like that dentists are doing to make sure that you're safe in whatever dental treatments you need. Avoid long dental appointments that can cause fatigue, especially in the muscles required to keep the mouth open. Especially if you're having weakness in the neck and mouth areas, you want to tell the dentist that you have this problem, and then avoid long dental appointments. I mean, some dental appointments could take a couple hours. Well, you're going to need to make sure that they know that you've got this condition, and they may need to schedule shorter appointments, and this can always be done. If extensive dental treatment is required, ask for the dentist to, like I say, schedule multiple shorter appointments if possible, and it's always possible. Don't be afraid to inform the dental team if you are fatigued during the procedure and need to reschedule, even if it's in the middle of the procedure. So don't worry if you're having trouble in any way, and you're maybe having a problem due to your myasthenia. Don't be afraid to say, doctor, I need to, stop right now and maybe come back and finish another time. Most dental procedures can be interrupted because we can always temporize whatever we're doing and postpone it to a later appointment. So in the middle of an appointment, if you're having trouble, just say, doctor, I think I need to come back at another appointment. And they can always make accommodations for you. If they can't, maybe it's time to see another dentist. The amount of treatment, chair position, and head support is important when there is difficulty in swallowing, holding your head up, breathing, or choking. Okay, so the chair position should be a compromise between you and your dentist, dental hygienist. If you didn't have MG, I mean, we are used to laying the patient back, way back, so we have great visual ability to see what we're doing, okay? But on a myasthenia patient, we have to make a compromise. Now, holding you straight up might not be the right thing because the dentist needs to see what he's doing. But the chair should be reclined not only to where it's tolerable to you, but to where the dentist or dental hygienist needs it for access and visibility to permit proper and safe dental treatment. I think this is really something that's important. There has to be a compromise, and there can be one. A small neck pillow can be useful to support your head, but most dental chairs have a contoured headrest for support, so that normally will take care of that. There's some important aids that you should be aware of and make sure that they have. A chairside assistant using a high-speed oral evacuation suction is very important. This is the suction that they use to get the water and saliva out of your mouth. That's very, very important. It needs to be working properly. And a handheld self-directed saliva ejector are important, necessary to remove saliva and water, especially when a drill or a cavitron, which the hygienist uses, is being used. That's what this looks like. That's the one that you can hold and move around. We used to call it the sucking question mark. It looks like a question mark. But make sure that they have that and it's working properly and you are able to use it. A rubber dam may need to be needed to isolate the teeth and to keep water and restorative material from getting near the throat, especially for restorative procedures. This is what a rubber dam looks like. It isolates the teeth so that the doctor can work on the teeth that he's treating, but the saliva and water doesn't go down your throat. Okay, so the water is in this area and is being picked up by the suction device or sometimes even by the saliva ejector. So there's some other forms that could be used. There's another one that's put here that retracts the tongue, has a suction, has a light. So make sure that if they're doing any sort of restorative dentistry, where you can maybe have a piece of amalgam or a piece of something, fall into your throat and choke you, make sure that they use a rubber dam. Dentists don't like to use it. We all did this in dental school, and there's a tendency not to use it for a lot of reasons. But make sure that if they're going to do restorative dentistry where something could fall into your mouth or throat, that they use something called a rubber dam. Ask the dental team to use a rubber mouth prop to keep the mouth open if necessary. This is what a rubber mouth prop is, and this keeps the mouth open so you don't have to strain to the muscles to keep your mouth open. So make sure that this gets taken out periodically to relax your jaw muscles when it's appropriate. Okay, so leaving this in there for an hour straight might not be the best idea for you. So ask to have it removed if you're having any kind of difficulty. Take a little break, and then you can put it back in. Be sure it's the correct size that does not extensively stretch the mouth and jaw muscles. So, these are adaptable. They have different sizes. So make sure that they're not really straining your jaw and they're using the correct size for you. How about dental anesthetics and medications? That's always very important. Most dental injections use a traditional dental syringe, and we use the drugs lidocaine or articaine. So this is what we typically use. This is the dental syringe. And there's an alternative to this, which I'm going to talk about. These injections usually cause collateral numbness to the lips, face, and tongue. Now, probably all of us have had dental procedures where we've had to have local anesthesia, and you walk away with your tongue and face and lips sometimes all numb, and that could be difficult for a myasthenic patient. This is what they do, a dentist will do for an upper tooth. They'll do something called an infiltration, which numbs your lip and face, okay? If they're working on a lower tooth, they use something called a mandibular block. So they're putting the needle in this area, and they're giving a block which will block and anesthetize all the teeth on this one side, but it'll also anesthetize half of your tongue. It'll anesthetize the lower lip on this side. And for a myasthenic that's having trouble swallowing or slurring their speech or having problems in that way, this may not be the best way to handle local anesthesia for lower teeth. Whatever, if you have to have this injection, never let them do it bilaterally. In other words, if you have to have something done on both sides of the mouth, don't let them give you a double mandibular block. In other words, this injection on both sides, because now your whole tongue will be numb. You'll have no feeling. You don't know where it is. Of course, all the teeth will be numb, but your whole lower lip will be numb. So there's an alternative to this injection, which I'll get into right now. There's an alternative to the 160-year-old technology of the dental syringe. A computer-controlled delivery system that allows a single tooth to be anesthetized comfortably without numbness to the lip, face, or tongue. And this is something called the Wand STA. This is the company that I work for. Okay, so I'm sort of the world's expert on this technology, and that's my job. It's a wonderful job. I enjoy teaching. And so what this instrument does is it produces a flow of anesthetic. There's a plunger, the anesthetic fits in here. It goes through a microtubing and through a little needle, through a little, we call it a wand handpiece, looks like a straw. It's got a needle attached to it. So the anesthetic goes through this and into your mouth, but it goes in slowly in a controlled form. When you use a dental syringe, you're dependent upon how much pressure you're putting on your thumb to deliver the anesthetic. Okay, with this, you can actually numb a single tooth, like I show you here. So let's say you had to have extraction, root canal, any procedure. Instead of numbing the whole side of your mouth and half your tongue and half your lip, we could do what we call a single tooth injection, injecting that one tooth and all the tissue around it for about an hour without any collateral numbness to your lip, face, or tongue. So this is a great advancement. It's about 23 years old. I've been working for the company 22 years. Like Jenna told you, I've been all over the world, and it's been quite an experience. I've enjoyed it very much because I believe in this. I use it in my practice before I left practice and come to work for this company. So if your dentist doesn't have this, you might want to suggest them looking into something called the wand. And it's very valuable, especially for myasthenics who don't really do well sometimes with a lower mandibular block injection. Okay, when taking steroids like prednisone and or immunosuppressant drugs like Imuran, Cellcept, Intraoral injections and delayed healing can occur. In case of a dental infection, the dentist should consult with your neurologist and physician regarding the use of antibiotics and sedatives when necessary. Antibiotics such as penicillin, erythromycin are routinely prescribed in dentistry and can be used when needed. But one drug that should not be used, and in the brochure that I talked about, it mentions some drugs that we should be aware, that you shouldn't necessarily use if you can avoid it. But this is one you should avoid at any cost. It's called Cipro, it's ciprofloxacin, and it's contraindicated for myasthenics. And sometimes a dentist may want to prescribe that, and you should know that this is not something you should be taking. Avoid taking alcohol and or Valium to reduce anxiety before your dental appointment. Things like nitrous oxide with oxygen, laughing gas, as you know it, and analgesia can be used for light sedation if you need it. When major oral surgery or periodontal surgery is required, and intravenous sedation, what they call it twilight sleep, where you're really not completely under general anesthesia, but just in what we call twilight sleep, or when general anesthesia is necessary, the procedure should be completed by both the dental surgeon and an attending dentist anesthesiologist. In other words, if you are not in remission, you're having problems, you might want to suggest that you need to have a dentist anesthetist along with the dental surgeon. So there are two people, one just taking care of the anesthesia and the dental surgeon taking care of whatever surgery or periodontal surgery, extensive procedure, so that he's, concerned about the procedure. The dentist, the anesthesiologist is concerned about you under the anesthesia. So I think this is very, very important. And I wouldn't be, I would say that you should actually demand this if you are having problems, but definitely suggest it in most cases. Respiratory support should be available if needed. That's where the dentist anesthetist comes in. These are dentists well-trained in anesthesiology that visit various offices to assist with the dental surgeon. Okay, so I think this is very important. Remain in the chair after the procedure until swallowing is under control and until the saliva ejector is no longer needed. Prevention is really important. Brushing with a fluoride-containing toothpaste and flossing between the teeth is important, even though it may be hard to do for some myasthenics. Electric toothbrushes and water picks, floss holders, and mouthwashes are important to oral health, and they can aid myasthenics. See the dentist and the dental hygienist regularly and stay on a regular recall. Avoiding dental emergencies that could not only be painful and stressful, but can aggravate your myasthenia gravis and possibly cause a crisis. So if you're having any sort of discomfort, get in right away. The longer you wait, the worse it's going to get. But the best dentistry is prevention, for sure. Great communication is essential. A good dental team and patient relationship is necessary. Don't be afraid to discuss your MG condition and limitations with the dental team at each appointment. I mentioned this before, but it's not just mentioning it the first time you're seeing a new dentist or dental hygienist. Mention it every time you go in. You have to tell them what your condition is that day. Remind them. Sometimes they forget. They might just put MG in the chart and really not know what it's all about. So it's very important on each appointment to remind them what your limitations may be. Don't be afraid to discuss your proposed dental treatment with the dental team and with your MG physician or neurologist, especially when you are unsure of how the treatment may affect you and your condition. So don't be afraid to talk to them. If it's an extensive procedure, say, listen, can we break it up into multiple appointments instead of just coming in and sitting there for 2-3 hours? And if it's something that's going to be requiring multiple treatments, you should discuss this with your neurologist. Don't be afraid to get a second opinion when needed. You know what? I was one of these people that if there was something over my head, listen, I'm going to refer you to somebody who's a specialist in your particular situation. But if you feel that whatever is being proposed as dental treatment is not something that you feel good about, that you feel like there's got to be an alternative to this, is there some other way of doing it? Don't be afraid to get a second opinion. I mean, don't be afraid of making the dentist upset or angry, because we should not be upset or angry if somebody wants to get a dental second opinion. Don't be afraid to change to a dental office that is responsive to your uncommon needs and requirements when it's appropriate. So you've told your dentist you've maybe been with for whatever, or maybe it's a new dentist, and they don't seem very responsive to your needs. Um, it's maybe time to think about finding another dentist. I usually tell my patients when they're moving, let's say, to another town, I'll give you some referrals. But when you walk into that dental office and you sit down in the dental chair and you don't feel comfortable, for some reason, your intuition is saying, I don't like the way they're treating me, or I don't like the surroundings. Something's just not right. Don't be afraid to get up and say, I'm not feeling well. Maybe I should come back another day or something. And find a dentist that's going to be caring and responsive to your needs. I think it's very, very important. There are some dentists that will, today's dentistry has changed a lot since I practiced, what, 50 years ago now? Almost 60 actually. We had our own private practice and we would spend time. And today's dentistry is different because many dentists are, in a group practice where they're more concerned about production and really, don't want to take the time to be responsive to your particular needs. And if that's the case, maybe it's time to seek treatment elsewhere. But be your own advocate. That's the key thing. You have to, if something's not right and they're doing something that is going to be harmful in any way to you, or it seems like it may be harmful to you anyway, say, doctor, I don't think that's the right way to do things. You know, I'll give you an example. This just happened this morning. I am iron deficient for some reason, and they don't know if it's because of the myasthenia or some other reason. So my physician says, well, you're on the iron supplements, but go see a gastroenterologist and see, you might need a endoscope and a colonoscopy and things. So I went in to visit this doctor today. He's the most wonderful doctor I've met in many, many years. He didn't have a computer in front of him. He listened to me. He listened to the fact that I had myasthenia. I'd had problems with previous anesthesia. He brought in an anesthesiologist that works with him. They talked to me and they decided that no, they weren't going to do what they intended. They're going to do it by taking x-rays. If they find something on the x-ray, then they'll go on and do something else. But, just because I talked to him and told him what was my issue, he accommodated me. And so you have to be able to do the same thing. You're special. Okay, so know that and make sure that the dentist knows that, and the dental hygienist knows that, and the dental team knows that. You have special requirements that might have to be used in your particular case. I'd like to thank Jenna for inviting me to this MGFA Wellness Series, and I appreciate the opportunity to give you some ideas that you might want to consider when you go to the dentist. And I would be happy to answer any questions, Jenna, if anybody has any questions. And I appreciate your attention.
Thank you so much. Thank you for that presentation, and especially pointing out things to consider in regards to being a self-advocate when going to a dental appointment. I think that's something that's really important and sometimes under stressed. So thank you for bringing that up. Our first question is, are there latex-free dams available? I'm allergic, so it has made molar fillings difficult.
Yes, there are. And you could tell if you have an allergy to latex, you should point that out to the team. And latex-free gloves are available. And I know that, for example, if you're going to a dentist, they are using the standard dental syringe for many years. The little plunger that goes into a membrane on the cartridge of the anesthetic was latex. And so now today they've changed that. Even that is latex free. But yes, everything in the dental office can be latex free.
That's great to know. This next question is, what are your thoughts on routine cleanings during COVID?
Well, actually, it depends on how you perceive the whole situation. I think, of course, if you've had your vaccinations, I think that's a no-brainer. I would then continue with all your routine dental treatments. If you're concerned, then you might want to reschedule something, unless you have a situation where you have to go in every 3 months. And if by not going in every 3 months or so, let's say a periodontal condition, that's going to worsen the condition, I would say it's okay to go to a dentist. Today, I suggested that the dentists are using ultra precautions, in this day of COVID. So you won't find any, magazines in the waiting room. The waiting room will be 6 feet apart, if you're sitting down. When you go in there, they've got, all the protective equipment that you could possibly have. And like I say, they use the standard precautions today, plexiglass, most of them. They have, many of dentists have the air filtration systems that they bought at great expense. But if they have those sort of things, I would not. I've been going to my dental hygienist throughout the whole time, and never had a worry whatsoever. So especially if you have a dental condition, whether you're having an emergency dental situation or something that could get worse without treatment, don't wait till it gets worse, or don't wait till you need a root canal or something, let's say. If you have a problem, I would not hesitate to go in and get it taken care of.
Great, thank you. What advice would you give to a newly diagnosed person with MG on their first trip to the dentist?
Well, like I said, it's very, very important to inform the dentist, not only that you have MG, and maybe explain a little bit to the dental team that this is a condition, a neuromuscular condition, and your muscles don't necessarily work so well, especially the facial muscles, chewing muscles and things like that. Then also tell them about your current condition. Give them the medications you're taking. Tell them that you have certain requirements as far as the condition you're in right now. You can't keep your mouth open for a while. There's plenty of patients that I have a myasthenia support group in Tucson, Arizona, and some patients come in and they, have to chew chew with their hand, forcing their jaw to chew. I mean, things like that. I mean, if you're having trouble swallowing, if you're having trouble slurring your speech, if you're having trouble eating, anything like that, you should tell your dentist that that's the situation, and they have to make certain, certain situations better for you that you can accomplish. Certain accommodations, what I'm trying to say, for whatever situation you're in. If you're in a situation where you're not having that many problems, then I think they'll probably treat you like they treat almost everybody. Okay, but at a certain point, you might get tired, and you might have to get up and say, listen, I'm tired, I can't do this for any longer, I can't keep my mouth open or whatever, and can we stop this and I'll come back and let's finish another time. Dentists should be able to accommodate you no matter where they are in the procedure. They can always temporize something and come back and finish it another time.
That's
But
great.
yes, make sure they're well informed. And like I suggested, you might even want to bring that MG pamphlet with you, because to be honest with you, I learned about MG in dental school, was on a test at one time. The test was like, if you see somebody coming in and their eyelid is drooping, what disease do they have? Myasthenia gravis. I didn't have a clue what it was. All right. And then 50 years later, when I was diagnosed with it, I had to go home and Google what it was. And I found out that was a poster boy for the disease. But your dentist doesn't really, in general, I would say, and I can say that for some physicians also, really don't know what the disease is and how it affects you and how it could affect the dental treatment. So it's up to you to inform them. And bringing in that brochure made by FGFA, which is being redone right now, updated, would be the best thing I could suggest. But make sure, just don't put it on the medical history and forget about it. That's not enough.
That's a great reminder. All right, this next question is, do pre-meds for heart murmurs affect our MG treatments?
Do pre-meds for heart murmurs affect the MG treatment or the dental treatment?
It's written MG treatment, but maybe we're asking about dental treatments.
So I don't think they would. I mean, as long as you're under control, I don't see any reason. I mean, do the same things I've just talked to you about, as far as, the accommodations needed for you to get the proper treatment at a dental office. But anything more than that, how it affects MG, I think that's for a neurologist to answer.
Okay. This next question there's a bit of a backstory, so I'm going to read it first.
Okay.
My thyroid cancer treatment has caused osteoporosis. I've been told to get a complete dental checkup prior to starting treatment for osteoporosis. I have a broken back top molar that should be extracted. I spent 7 days in the hospital last week because of breathing issues. My condition is not stable. How do I find a hospital-based dentist? And how long should I wait between a crisis and a dental extraction?
That's a very, very good question. Osteoporosis is an issue, and it can cause, osteonecrosis. In other words, when we take out a tooth and the blood clot doesn't form properly, you can actually get an infection in the bone in that area that could be very serious. Okay, so I would suggest that if you've got that situation, you need to get it taken care of as soon as possible. I think you could call the local dental society in your locale. They always have whatever, Los Angeles Dental Society, for example, and you call them, they would be able to refer you to a dentist that does hospital dentistry, or maybe an oral surgeon that could do it with a dental anesthetist, in cooperation with a dental anesthetist. But I would not go to a regular dentist with your condition and just have a regular dentist take out that tooth. I think you need to be treated by an oral surgeon with that condition, especially if you have a situation with osteoporosis. That's who I would recommend seeing, and maybe one that would say, listen, we need to do this in the hospital, but not in a general dentist's office. I don't think if you were coming into my office, I would refer you to somebody.
Okay, thanks. So I think that's the questions that we have in the chat. I know that you said you have a couple additional frequently asked questions.
Yeah. From previous, maybe one or two of these we could talk about. One of them that was asked at another presentation was, when visiting the dentist, are there any drugs that could have conflict with my CellCept prescription? My answer would be Amaran or CellCept are immunosuppressant drugs, which can predispose an oral wound to infection and delayed healing. So antibiotics may be needed after oral surgery, or even anything that would involve, bleeding. So you have to consider that oral antibiotics might be necessary. That's something you should talk to your dentist and your neurologist about if you have that. Many drugs, especially pain medications, may have potential complications for myasthenics. And these can interfere with breathing and muscle weakness. I would be careful of narcotics, hypnotics, and barbiturates like codeine. And this is standard. For many years, they have different ones today, but if you took out a tooth and it was going to be a lot of pain involved with it, or implants or whatever, you would prescribe something with codeine in it. Okay, and many people have reactions to codeine that will shortness of breath, lowering their breathing in such a way that could be serious. So I would be careful about those kind of hypnotics and barbiturates. Local anesthetics and antibiotics should be safe and okay, especially, again, I'll say avoid CPRO. And again, I say if there are any questions, you should involve your neurologist. What is the risk with Valium or similar drugs? I think it was in a chat here. Let's see if I can pick it up. What's the risk with Valium or similar drugs for anxiety? Besides usually well-controlled myasthenia, which affects, which affects my diaphragm breathing, but only when I'm stressed. I have chronic sinusitis and difficulty breathing through my nose. Welcome to the club. I require Valium if a dam is required, such as for a root canal. Otherwise, get a panic attack. I also need an air hole to be cut in the dam. That's all right, on the opposite from where the dentist or endodontist is working. It helps to take Afrin the night before the procedure, but I still need to be able to breathe through my mouth. Finally, I do not tolerate devices that hold the jaw open. They also call panic attacks, even if I'm medication with nitrous oxide or Valium. I think that's related to swallowing difficulties. I do much better just by keeping my mouth open. Well, this is why we call myasthenia gravis the snowflake disease, because everybody's different. I mean, that particular patient has a particular situation that needs to be accommodated. Yes, a little hole in the rubber dam is important. There are other ways, Valium, low prescription, low dose of Valium can be used. There's other things that they can be used. Nitrous oxide is a wonderful way of reducing the stress and anxiety. What else? Today, what I used to use, believe it or not, I was trained in hypnosis. So I could hypnotize a patient and do whatever I needed to, especially on children, and give them injections and do whatever I needed, and then wake them up. So you might want to even consider, there are dentists that are trained in hypnosis. That might be another option for you. It helped me because when I was a young dentist, I spent the first 3 years of my practice in Beverly Hills working on celebrities that you would know. I'll just drop one name, Steve McQueen and his family. But they were, so uptight that I could hypnotize them and do whatever I needed to do. So there are other forms: nitrous oxide, hypnosis, drugs like Valium, as long as you use properly. It sounds like you have a certain situation that you should find a dentist that is able to accommodate you. Of course, the most things that patients fear about is the injection. And that's why I'm so fortunate to be able to talk about this, innovation in dental anesthesia that, is something that the patient doesn't, have any anxiety about. Because I can actually break that little plastic thing down and hold it in my hand. The patient never even sees a needle. So there are dentists that really pay a lot of attention to making patients comfortable and allaying their anxiety in one form or another. And that's the kind of dentist I think you need to see. Other dentists just, I hate to say it, but some dentists don't care. And that's just, human nature.
Thank you. Yeah, so it sounds like it's really great to know the options for dentists, what you should look for, and really be flexible with finding the right fit. We have another question. Is there any danger to MG patients with nitrous oxide? I find when it's too high, it affects my breathing.
Right. So you should be in a dentist's office that knows how to regulate. Okay. I mean, there's a way to use nitrous oxide that's the proper way. So you increase the dosage of the nitrous oxide versus the oxygen. You're getting nitrous oxide and oxygen. Okay. So if it's too high, just raise your hand and say, it's not, it's too high. Okay, it should be a very relaxing kind of a feeling you're getting, not something that's deep. Okay, so it should just relax you. It shouldn't be putting you near, having feel like you're going to sleep in any way. Okay, so you might just say, listen, just don't be afraid to tell the dentist. Listen, I think I'm getting too much. Can you reduce it? And they'll find that spot, which is the proper spot. Maybe he's just using too much, and that can happen.
That's great. Thank you. I did want to let everybody know that in the chat icon, you can find the link to the dental treatment considerations document that Dr. Casagrande was referring to earlier. So if you go in the chat, you can click on that and it'll direct you to that. You can also print it out and bring it with you to your appointment if you need to. Did you want to do one more question that you frequently get asked?
Let me see. This applies to what we just talked about. Any further recommendations for dental phobics? I haven't stepped foot in a dental office for years due to extreme anxiety regarding any dental procedure. Now that I have MG, it is unimaginable to place myself in an environment like that, especially when I cannot safely take sedative medication due to MG. Well, in fact, you can take sedative medication as long as it's in a dose. It's not going to have that much of an effect. And again, it depends on what level you're at are you in remission? Are you still having trouble? It really depends on, what stage of the MG and you're in. But I say that something that you already know, that the longer you wait to see a dentist may result in far greater oral disease conditions, including infections. They could become more serious with myositis. So waiting is not the best idea. You're going to have to find a way to find a dentist who will be responsive to your needs as far as anxiety and phobics. Okay. Dentistries have changed a lot over the years. Many dentists are able to successfully and comfortably treat phobic patients. Usually patients don't like the noises and the injections. Dentists use things like music headphones and the noise, or drill bothers you. Some dentists use hypnosis, like I mentioned, and nitrous oxide, and many use the wand, like I suggested also for local anesthesia, if you have phobia as far as the injection. That is something that is very important. Because it's a comfortable injection. You don't feel the injection because it's going in so slowly. It's like an IV drip. So when I talk about a single tooth injection, the dentist is going to put the needle in that site near the tooth and let the anesthetic drip into the bone around the tooth without you feeling anything. And so it doesn't, again, cause collateral numbness. Some people are nervous and have anxiety about leaving the dental office with their lip, face, and tongue numb. It bothers them so much that they won't go in there for that reason. And plenty of reasons that they want to avoid going to the dentist. Okay, so some dentists practice sedation dentistry using the dentist and anesthetist to administer the sedation while the dentist performs the dental procedure. We talked about that. So that's another consideration. And again, if you need a referral, I would suggest calling the local dental society in your town, and they will refer you to somebody that will provide that sort of dentistry. This could be conscious sedation, better known as twilight sleep, where you're awake, or general anesthesia, where you're not awake. I would only undergo these procedures when there is a separate dentist anesthetist specialist present in case of any complications. This should be very safe. But I'll say it again: delaying going to a dentist because of fear and anxiety is only precipitating a more serious problem in the future. So you're just going to have to find a dentist that uses sedation dentistry in one form or another. They're out there. There's some dentists that that's their specialty. And that's how they advertise their practice. And so they're going to take time to make sure you're comfortable. And there is no reason really not to go see the dentist because of anxiety or fear. We can solve any one of those problems. So I highly recommend that, waiting is not the answer.
Thank you so much. Well, this concludes our webinar today. We want to say thank you again for all of the attendees who are able to join us today. We will be posting this recording live. We want to thank you, Dr. Casagrande, for your time, for your insights, and for teaching us about some of the considerations that should be brought when scheduling a dentist appointment and going to the dentist.
It was my pleasure, and God willing, this whole virus will be over, and I hope all of you are safe and following the proper precautions. And really, to be honest with you, find a dentist that will accommodate to your needs, and don't be afraid to go to the dentist. Okay.
Yeah. Thanks, everyone. Take care and
Okay.
have a great rest
Thank
of your
you
day.
all. Stay well.
Bye.
Goodbye.